Welcome to the Health Matters program produced by the Ministry of Health. I'm your host, Alicia Martin. We're observing Caribbean Mosquito Awareness Week, which is a collaborative initiative between the Caribbean Public Health Agency, the Caribbean community, and the Pan American Health Organization. Joining me in discussions today are microbiologist Mr. Daryl Saul and Ms. Chauncey Henry. Mr. Daryl Saul, welcome to the program. We're observing Mosquito Awareness Week under the theme Fight the Bite, Eliminate Mosquito Breeding Sites. Could you tell us about Mosquito Awareness Week and what this annual event is about? What can we look forward to?
That's a very good question. First off, thank you guys for having me here today. Mosquito Awareness Week. So as the name implies, Mosquito Awareness Week is a week of bringing awareness to medically important vectors within Guyana, though this is a collaborative event between the Caribbean Public Health Agency, CARICOM, and PAHO WHO. It's celebrated in the first week of May annually, and we just shed some light on these vectors, how it can be controlled, how we can prevent vector-borne diseases, and things along those lines.
Okay, what could we look forward to this year with regard to activities?
So we have a few activities planned for this week and a few other weeks continuing. So for this week, we'll be engaging with the young adults, the schools, mostly some secondary schools in Georgetown on the East Coast, on the East Bank. We found this necessary because children are more receptive to the information that we have to share, and they're better able to translate these information to their parents, and it all adds to bringing awareness to these medically important vectors that we focus on. We'll be visiting some ports of entry such as Breeding Hoop and Pericastellian. We'll also be on Main Street. That's going to be on Saturday, so feel free to check us out. We have a booth. Who knows, you may be able to win an umbrella, some shopping bags we have up for grabs. We have keychains, so don't be shy, come out and support us. We will also be at the Seawalls on Sunday, so do give us a look so that we can engage you, we can educate you, we can inform you on why are mosquitoes of importance, medically speaking.
Wonderful, so many activities. We're definitely looking forward to those. I know the Vector Control Services has been doing a lot of work over the years in the various regions of Guyana. Could you tell us about the objective of your unit?
Great question. So here at Vector Control Services, we mainly focus on strengthening the capacity for the prevention and control of key vectors in Guyana, and also to reduce the transmission of vector-borne diseases. So our department have 4 different subunits. Mainly we have the Medical Entomology Unit, that's the department where I'm from. We have the AIDS disease program. We have the NDIA, Neglected Infectious Disease, and we have the Malaria Unit. Most persons are familiar with the Malaria Clinic. There we treat persons that may have been bitten by a mosquito that was infected with the malaria parasite.
Okay, and how do these units operate on a daily basis?
Okay, so in terms of the ADs and the Medical Entomology Unit, we mainly focus on interventions such as fogging. Yeah, the fogging exercises, most persons know, we go into the various regions and we expel the chemical in a gaseous form to be able to kill the adult mosquitoes. Also, for the Medical Entomology Unit, we focus mainly on research, how we can better build capacity for controlling other vectors that may arise, such as the kissing bug, the sandfly, and so on. The Neglected Infectious Disease program, they dealt with the IDA impact survey. That's where they had the filaria campaign. Yeah, you guys are familiar when persons were coming out and asking you to take your filaria pills. And malaria, yeah, not forgetting malaria. So malaria, that department usually helps to distribute the bed nets, for persons who are living in endemic region, malaria endemic regions, such as regions 1, 7, 8, and 9, and some parts of region 10, and minors who are going out into the region, because this is why it's important for us to bring awareness, because persons are then able to equip themselves with the necessary measures, like the necessary, as in the case of the bed nets, they're able to procure a net and be able to go into the region so that they can help prevent getting bitten, I guess, by a mosquito. So it's important to build awareness around those aspects, but my other colleague will be getting into fleshing that out a bit more.
When you hear she buzzing, big problems coming, big problems coming, big problems coming. Look, this little mosquito, big problems coming. I said this little mosquito, big problems coming. Look, this little mosquito, big problems coming. I said this little mosquito, big problems coming. I was lying in my bed when she come hustling. You see, it's nighttime and she got a need for feeding. Suddenly she bite me, and before I know it, she left me with a itchy feeling. Days pass, I'm back in my bed, don't know what I'm doing. Suddenly what she left me with a broke up feeling, a broke up feeling. Big problems coming, big problems coming. When you hear she buzzing, big problems coming. When you feel she biting, big problems coming. When your skin starts itching, big problems coming. And when you start scratching, big problems coming. Look, this little mosquito, big problems coming. I said this little mosquito, big problems coming. Look, this little mosquito, big problems coming. I said this little mosquito, big problems coming. So I get up to take some action. Them boys are drink the concoction, but I remember seeing this sign, free malaria test that catch me eye. So I go down by the landing, free treatment all them man giving. So I decide to take the test that it's a yes. When you hear she buzzing, big problems coming. When you feel she biting, big problems coming. When your skin start itching, big problems coming. And when you start scratching, big problems coming. Look, this little mosquito, big problems coming. I said this little mosquito, big problems coming. Look, this little mosquito, big problems coming. I said this little mosquito, big problems coming. Avoid wrong treatment, don't take the risk. Get the facts and show you know this. There's a difference, yes, between 5-Ax and falciparum. I got to know which one I got so it don't come back. The full treatment is best, or the malaria gon' only rest. If I drink the right and full treatment and sleep under my net, this little mosquito won't be a big threat. When you ready buzzing, big problems coming, big problems coming, big problems coming. When you feel she biting, big problems coming, big problems coming, big problems coming. When your skin start itching, big problems coming, big problems coming, big problems coming. And when you start scratching, big problems coming, big problems coming, big problems coming. Look, this little mosquito, big problems coming. I said this little mosquito, big problems coming. Look, this little mosquito, big problems coming. I said this little mosquito, big problems coming.
Ms. Chauncey Henry, could you tell us what vector-borne diseases are? We hear this term so many times, and it doesn't mean that everybody knows what this entails. Could you tell us about this?
So before I start off with what vector-borne diseases are, I should tell you what a vector is. So a vector is an organism that would transmit a parasite from a infected individual to a healthy person, right? Some of the vectors we mostly focus on are mosquitoes, and we're also trying to build capacity on controlling the sandfly as well as the kissing bug. These vector-borne diseases are the human illnesses caused by mosquitoes. And in Guyana, we have 3 main mosquitoes, such as the Culex, which is found in all the administrative regions. And that mosquito would most likely transmit the popularly known disease, filaria. We have anopheles, which would be mainly found in the endemic regions such as regions 1, 7, 8, and 9, and some parts of 10, and that would transmit the malaria. And then we have, last but not least, the Aedes, and that would transmit dengue, chikungunya, Zika, and yellow fever. So these are the vector-borne diseases that we target in Guyana.
All right. What are some of the signs and symptoms of these?
So the general signs would be like flu-like symptoms such as nausea, vomiting, headaches, common cold and flu. But with chikungunya, we would find most likely you have joint pains. With the malaria, you would find people would have chills. The place could be as hot as ever and people still have chills. With the dengue, we would find that when people come to do a blood test, they will have a low platelet count. And also with filaria, it's known you usually have elephantitis. So those are the main signs and symptoms you find in these vector-borne diseases.
You've mentioned 3 mosquitoes that are of medical importance here in Guyana. Could you tell us about the life cycle of the mosquito and how this works?
So they require a little amount of water to start their life cycle. And even if they don't have these favorable conditions such as the water, or they like dark shades, they can lay their eggs in unfavorable conditions up to 90 days. But so let's say they actually do have these favorable conditions, they lay the eggs in the water, and these eggs can hatch within about 2 to 3 days. And from that, they hatch into the larva, and the larva can last in the water up to 5 days. From the larva, it's transformed into the pupa that stays about 2 to 3 days. And then from the pupa, it emerges into the adult, and this cycle can repeat itself, whereas the female mosquito will lay her eggs. So why are we touching on the public awareness is that we're imploring citizens to eliminate the breeding sites, because any container, any material that can actually accumulate water, it gives the mosquito a chance to reproduce, and it's hard for us as vector control services to actually control the population, because we're only targeting with the flocking exercise, we're only targeting the adult population, but citizens can actually help us by just doing the small things in their yard or their vicinity. So some other interventions other than the fogging exercise would be just to, because we would usually do housing inspections, and we do the insecticide resistant testing, and when we do housing inspections actually, or we do public campaigns and so on, we would usually try to educate the public about getting rid of tires, getting rid of containers. A lot of people, they use barrels to store water, and that's not a problem, but you need to keep it covered, because mosquitoes are going to lay their eggs in the water, and then you're going to find larvae, you're going to find a pupa and so on, and that's not good for your human health. So we would usually implore them to cover them. If you're not using a container in your yard, you need to get rid of it. We ask you to bore holes in your garbage bins to get rid of the water, because Culex is found in all the regions, and the reason why they are found in all these regions is because they can thrive in a dirty environment. So keeping your yard clean helps us to eliminate the population of the Culex, for instance. There's a pipe that you would find by your septic tanks. We usually implore people to cover those with nets, because mosquitoes will thrive in that environment. They can lay eggs in that environment. And just basically turning over containers that you have in your yard, just turn them over and not allowing them to accumulate any water. Even like small plastic containers, a plastic bag, a cup, anything that can store water, we implore people to just try to get rid of it or to cover it to prevent that.
Mosquitoes go through 4 stages of development in their lives. They undergo complete metamorphosis. Culex mosquitoes lay their eggs on the surface of fresh water, or in areas that will be temporarily wet, like floodplains. The eggs float alone, or in groups that look like rafts. Eggs laid during winter can survive to hatch in the spring. Mosquito eggs hatch into larvae, The larvae live at the surface of the water and breathe through a tube. As the larvae grow, they shed their skin a few times. If mosquito larvae need to hide from predators, they can swim and dive below the water's surface. Mosquito larvae live a few days to a few weeks before they turn into pupae. They stop feeding just before they turn into pupae. The pupae live at the water's surface and breathe through two small tubes. Mosquito pupae do not eat, but they are active. They tumble below the surface of the water when disturbed. They remain in the pupal stage anywhere from 1 to a few days, depending on the water temperature. While inside the pupa, the larva transforms into an adult. The adult breaks out of the pupal case and crawls onto the surface of the water. It rests while its exoskeleton hardens. Later, it crawls to a safe place out of the water and spreads its wings out to dry to prepare for life on land. The mosquito is now a flying land insect. Adult mosquitoes mate to produce eggs for the next generation. Adult female mosquitoes can live from many days to weeks, while adult male mosquitoes usually live just a few days after they mate.
So, Mrs. Saul, when it comes to prevention, we want to first talk about treatment. What treatment is available for those persons who may have experienced signs and symptoms of either one of these vector-borne diseases that we would have mentioned early on in the program?
No problem. Okay, so for dengue, if they're presenting one of the hallmark signs or they're tested positive for dengue, they can visit any of the healthcare centers because they are personnel there to assist healthcare professionals, of course. And for malaria, we have the malaria clinic where persons are admitted and they are given all the necessary care and treatment that they may need to. Because malaria is curable, you just need to follow the correct course of treatment to be able to rid yourself of the disease.
And for persons going into the regions, how can they access or be able to pick up a bed net?
So we have an office here at the ministry, outpatient. You just come into the office and provide us with your identification card and the reason for the visit, basic information, and we'll be able to provide you with a bed net. But mostly we are now trying to decentralize. So if it is that you are going to Region 8, we would advise you to visit Region 8 healthcare facility or hospital so that they're best able to assist you.
Okay, and for persons in the various communities, how can they come on board and be able to help in the elimination of breeding sites?
Okay, so as Ms. Henry would have mentioned, public awareness is integral. So persons being able to get rid of any mosquito breeding site within their immediate vicinity, that will help us a lot because we are only able, well, most of the times we are targeting the adult population. We may do some treatment of the insect in their larval form or in their pupae form, but this needs to be continuous so that we'll be able to see long-term results. So a simple act of covering your containers, boring a hole at the bottom of your bins, turning over tires or boring a hole in the tire so that no water can accumulate, those simple acts goes a long way. So it will help us in the long run to rid Guyana of vector-borne diseases.
It's a community effort. Everybody can come on board
It is a
and
community
assist.
effort.
Definitely. What are your future projections, the future projections of the department in a whole? What can the public look forward to from you guys in the future?
In the future, that's a very good question. We have been talking about SIT, the sterile insect technique method, where the mosquito is exposed to a certain level of radiation to help them to become sterile. They're no longer able to reproduce. We are looking into that method of control, and also more community engagement, more IRTs, insecticide resistant testing, where we check to see if the mosquitoes have developed a resistance to the chemicals we usually use. More of those you can look forward to, because if it is that they do develop a resistance, then we're able to pivot and use another form of control. So it's important. We also will be having research done continuously, because this is a work in progress, and we are progressing. We are progressing.
Do you have any final words for our listening and viewing audience before we end today's program?
Of course. I would like to encourage persons to fight the bite, eliminate mosquito breeding sites, because we need you. We cannot do this by ourselves, and we need your involvement in helping Guyana to get rid of vector-borne diseases.
Thank you, Mr. Saul. There you have it. Thank you for staying tuned with us. I'm Alicia Martin, saying goodbye for now.